So how do you feel? No, I mean, how do you really feel? Tired, run down? Even though you try to eat right and get a good night's sleep, you may want to take a closer look at what your body is trying to tell you. Dr. Meghna Thakur is here from Tutera Medical SottoPelle Therapy to explain how hormones, or lack of them, may be the problem. And along with her is Rachel Wellen. She is a client, and she says SottoPelle Therapy saved her life. I'm going to get to you in just a minute, Rachel. But first of all, Dr. Thakur, I want to talk about how the lack of hormones just seem to drag us down. Why do they affect our energy levels so much?
Absolutely. So I would like to address three important hormones. The first one being cortisol, which is a stress hormone made by the adrenal glands, and it should be highest producing hormone in the morning.
Okay.
But people who have difficulty waking up and getting the day started, there usually can be a lack of cortisol.
Okay.
The other one is the thyroid hormone, which takes care of our metabolism. So if the thyroid is slow, we're just slow in general, sluggish during the day, we need more naps. And the other one is testosterone. Testosterone not only helps us with our physical energy, but even with the mental energy and the clarity and focus.
So anybody watching at home, the ladies I know just went check, check, check on all of those, right? You do something a little bit different there, where you do, it's where you look at macronutrients, which really means the foods that our body is and how it's metabolizing, all through a blood test. What does that tell you?
Yes, let me share the micronutrient test with you. So macronutrients are actually the proteins, carbohydrates, and fats that we get from our food. But the micronutrients are the important nutrients which are intracellular. So this is a test which is done with a blood draw, and it's sent to this lab where they grow the white blood cells over 3 weeks, and they look inside the cell to provide you the report of all your vitamins, minerals, antioxidants, amino acids.
So it's really how our body at that point, with hormones or lack of them, how they're really metabolizing everything, right?
Exactly.
Okay.
And that way we can individualize the treatment.
This is really a cool test. I've not heard of this before. I absolutely love it, and I want to do it. Okay, Rachel, I want to ask you something. The moment you walked in, you are really emphatic about how SottoPelle has changed your life. Where were you at when you first walked in the door in your life? What was going on?
I'm a breast and ovarian cancer survivor and went into instant medical menopause after having a full hysterectomy and a bilateral mastectomy. I hit all menopause symptoms right away. I didn't feel good. I was depressed. I was in bed. I even got to the point where I was suicidal.
Oh.
I had picked a date and I was done.
Oh my God.
And my neighbor and I were talking one day, and she's like, "You're dripping in sweat. You're not okay." She goes, "Have you had your hormones checked?" Oh. And I said, "I don't know anything about this." And she goes, "You have to go to SottoPelle. They're amazing." And I went in, and Dr. Tutera actually did the blood work for me, and I had estrogen levels of an 80-year-old woman.
Oh my
And I'm in
gosh.
my 40s. And he goes, "We've got you." And for 4 years now, I've been treated. I'm just a new person, and I'm so... They really did save my life, and I know that sounds corny, but they
does not.
They did such an amazing job, and I really appreciate what they have to offer to everybody.
And you know, Rachel, think about this. So a lot of people are sitting at home. I actually have tears in my eyes for you, feeling the same way, and maybe at the end of their rope. And what this therapy has done for you may have just changed so many other lives. And I thank you for sharing your story, and I'm glad that you're successful and back on the road to recovery. Dr. Thakur, very quickly, we're looking at some supplements that you brought along. One of the special offers is an energy booster that you're offering. What is it doing to our body?
Yes, the energy booster is recommended once a week. It's a great mix of your B vitamins, a chromium that balances your blood sugar. It has AMP that converts to ATP, which is your energy building block.
Okay,
yes.
All these important elements on top of probably needing your hormone levels checked would be a really good idea. Rachel, thank you for sharing your story. Dr. Thakur, thank you for the information. And I want to tell you about a special offer that Dr. Thacker's brought for you today. If you buy one, basically, actually, if you buy 5, you receive 1 free energy booster with the purchase of 5. Tutera Medical SottoPelle Therapy. They have locations in Scottsdale, Chandler, Glendale, and Paradise Valley, certainly one close to you. They also offer consultations, 480-874-1515. Learn more at tuteramedical.com.